I have vivid memories of my father, his work that was original, fascinating, and meaningful. He said, "This is research." So from that moment, I always had the desire to taste these ingredients sometime in my life.
I see the patient as a problem which I'm not able to solve, and I try and see if there's some research we can do to try and solve the problem. Sometimes my fellows will ask me a question and I don't have the answer, and we try and find out the answer and we still don't have an answer. And again, that's a question for research.
Dr. Patrick Kamath, he's been instrumental in guiding me throughout the last 35 years. Also be loyal, not just to country, but also loyal to St. John's Medical College, where I have now worked for 28 years. Loyal to patients and also the data that they provide towards research.
Who was Salim Yusuf? He was at that time in the NIH in the US. So he said, I'll give you a little fund. We did a study called a case control study. And we did it with the nurses in the CCU and with one assistant from Savita. And it was, in fact, the first publication from St. John's on a clinical subject in the Lancet.
I've always been interested in asking questions. As medical students, very fortunate to have inspiring teachers. In anatomy, we had a lady called Manorama Thomas, who was the head of anatomy when we were medical students. And that got me very interested in looking at things beyond anatomy. In physiology, we had a teacher who joined actually after our first 6 months called Prakash Shetty.
It was basically the quest to know more and the information that I don't know anything.
I've always been curious to know what's ahead.
But it was a general curiosity and an unwillingness to accept that what I was told was the truth. The urge to do research was always there.
I'm embarrassed to say it, but I actually drifted into research. I don't think I've been influenced by anybody. I don't think my path has been shaped by anybody.
I did a project when I was a second-year student with Anurag Kurpar and Patrick Kamath. It turned out to be an absolute failure because the hamsters that we looked at didn't develop gallstones. I think that was a really good lesson, that research doesn't result in instant success. I came to the UK, met a real stalwart in the field of clinical nutrition called Simon Allison. He did really groundbreaking research that has changed clinical practice in the field of fluid and electrolyte balance.
Donkey work is in writing the protocol in the format that is required for the institution, for the ethics committee, pages and pages and pages and copies and copies and copies. It drives me crazy.
In your paper, disseminated, published.
Publishing the paper, meeting people's expectation,
Time management, and more importantly, people management.
Time is the most important and most difficult component of research.
Having the time to do it. Despite the obstacle, you have to find a way around. You need to be able to communicate well with people, convince people.
In India, we are overwhelmed with clinical work. There's little or protected time for research. So juggling both research and clinical work is always a problem.
Although you may have protected research sessions, if a patient needs care, you've got to drop that. And so a lot of the work is done at home and out of hours. Surgeons always look at things differently, and we are really problem solvers. And so as a surgeon, most of my research has started off as identifying a clinical problem and then going and trying to solve the problem.
Collaborating between an external site and an Indian site is super difficult.
Generally, I don't think collaboration is difficult if you ask a very good question. The limiting factor for most clinicians is they themselves are trying to find the time for research. I think that is the most challenging.
Research really is a series of activities. It's not about asking one question and stopping there. That's what a child does. What you really want is the ability to take it to the very end, a killer instinct, which says you ask the question, you open the circle, then go out and close it. And that means really, at some point when those results aren't what you thought they were, when those results are hard to decipher, that's when it becomes difficult. And that's where it takes character to keep going, sometimes to design the next experiment. It requires resilience, persistence, and that ability to get out of bed every morning and say, I've got to keep going on.
The teeny weeny chance that probably I can bring about a change.
Once you dive in, it becomes a part of you and your professional life.
That's easy, and that I think is duty. To me, duty supersedes any other virtues of qualities of human life.
Habit. I can't imagine myself leaving my journals, my statistics, my research, everything that I'm doing.
Curiosity.
Passion.
Passion, finding an answer to a question. Keep going from one question to the other. Hopefully, getting new generation of people to also do research as well as treat patients.
Clearly, patients and my fellows.
Madness. People who like to see their name in print and publish papers have got a psychiatric disorder, and perhaps I have that same disorder.
To channelize your inner curiosity. It helps for a young researcher to find a mentor. The mentor is there for one reason only: keep that curiosity going, to keep the fires burning, and to make it possible.
Serendipity and drawbacks always help, but at the same time, do research because you want to do it, not because you're forced to do it. And maintain honesty and integrity all through the process.
Take up an area of interest that you like, not something that is thrust on you. Start a bit early, keep a registry going, and then once you start getting patients, you start seeing patterns that other people perhaps have not recognized, patterns that you see, and that pattern perhaps goes on to become some kind of a novel idea, and that helps you with the research.
You have to be open to being proven wrong, and I think that's often very difficult to do when you're young and want to have everything go your way.
Keep an open mind. Be open to change.
Maintain that kind of passion, that curiosity. If your minds are open, then you can always progress in research.
I would say try it out. Research will also help you evolve as a person, as a better thinker, reader, writer, communicator, and an effective leader.
Keep asking questions and be patient.
Have lots of patience and perseverance.
Patience, persistence, and passion.
It's like climbing a mountain. So when you publish a paper, your academic quality is appreciated. That's a feel good feeling that people can't take away from you.
I think it is ask a clinically relevant question. Ask a question that clinicians want an answer to. Then try and find the time for research, and most important of all, never give up. They were getting gentamicin-resistant urinary infections, and Foley catheters were reused. We took 6 catheters and we cut off the tips and cultured them, and all of them grew Pseudomonas. And so we thought we had done something interesting there, but instead we got reprimanded, A, for cutting up catheters, and B, for culturing them without permission.